Welcome to our Mock Interview Pro Series, where we help you prepare for your upcoming audiologist interview with confidence. Today, we'll walk through some common interview questions you might encounter and offer tips on how to give your best answers. Let's dive into the first question. Have you ever had to handle a difficult patient? And how did you approach that situation? Could you share an experience where you had to manage a challenging situation with a patient? How did you handle it? Interviewers ask this to understand how you manage patient interactions, especially in stressful situations. Here are some strategies to consider when crafting your answer. Keep calm and give the patient your full attention. Show empathy and acknowledge their feelings. Provide clear options and involve them in decisions. Ensure follow-up to confirm their needs are met. Now, let's look at an example of how you might answer this.
I had a patient who was frustrated with their hearing aid fitting. I listened closely to their concerns and reassured them that this issue was common. By offering several adjustment options, we collaboratively found a solution that significantly improved their comfort and satisfaction.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for audiologists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you tell us about a time when you collaborated with a team to create a treatment plan for a patient? What was your role in that process? This question is meant to gauge your ability to work effectively as part of a team and your contributions to collaborative efforts. When crafting your response, keep these suggestions in mind. Pick a specific case to describe, with clear details about the team involved. Outline your role and contributions clearly. Emphasize teamwork and collaboration. Discuss the outcome and any lessons learned. Let's go through an example. Answer together.
In a case involving a pediatric patient, I worked closely with an ENT specialist and a speech therapist to develop a treatment plan for a child with hearing loss. My role was to conduct comprehensive audiometric assessments and present the findings to the team. Together, we decided on the best hearing aids and therapy sessions, which greatly improved the child's speech development.
Have you ever encountered a challenge during a hearing evaluation? How did you resolve it? This question helps interviewers assess your problem-solving skills and how you handle unexpected challenges. Here are some points to consider when forming your response. Identify a specific challenge you faced during an evaluation. Explain the steps you took to resolve the issue. Reflect on the outcome and what you learned. Focus on your role and contributions. Here's an example of how you might answer.
During a hearing evaluation, a patient became uncomfortable during testing. I paused, reassured them, and adjusted the equipment settings. Once the changes were made, we resumed the evaluation successfully, resulting in more accurate results and a better experience for the patient.
How would you handle a situation where a patient refuses to accept a hearing aid recommendation? This question explores your ability to navigate patient objections and educate them on the importance of treatment options. Consider these strategies when addressing such a scenario. Listen to the patient's concerns attentively. Ask open-ended questions to understand their objections. Inform them about the benefits of hearing aids. Offer alternatives or trial options if possible. Follow up later to see if they have reconsidered. Let's take a look at how you might approach your answer.
I would start by listening to the patient's concerns and asking what specifically worries them about hearing aids. By understanding their perspective, I can address their fears, inform them about the benefits, and suggest trying a demo unit to alleviate concerns.
Imagine you're in the middle of evaluating a child who suddenly shows signs of distress. What actions would you take immediately? This question assesses your ability to remain calm and responsive in potentially stressful situations. Here are some steps to guide your response. Remain calm to reassure the child. Pause the testing to assess the child's needs. Engage gently to understand the source of distress. Use simple language to communicate effectively. Adjust the test or take a break as needed. Here's an example of how you might handle this scenario.
I would immediately pause the test, kneel to the child's level, and ask them gently what is bothering them. By using calming language, I would create a supportive environment to understand their needs and adjust our approach if necessary.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free. Just grab it below.